Welcome to Cape Ann Report. I'm your host, Maureen Aylward. Cape Ann Report is a weekly show that covers programs and events on Cape Ann. For this show, we have the pleasure of having Chief Leonard Campanello from the Gloucester Police Department to discuss the Gloucester Initiative and the Angel Program. Chief Campanello, thank you for being on Cape Ann Report.
It's my pleasure.
It's a real honor to have you here and such a special, important program that you're working on right now here in Gloucester. And start us off with telling us about the Gloucester Initiative and the Angel Program.
Sure. Well, in March of this year, we had 4 deaths in the city already from opiate overdose. And very briefly, there was a call to action by the City Council, the Healthy Gloucester Collaborative, the Police Department, which kind of culminated in a citywide forum on May 2nd. At that forum, all of the health organizations and the City Council were present, describing the things we had in place in Gloucester to help with the opiate epidemic. And the Police Department announced a 3-tiered program, which was the Gloucester Initiative. First, that anybody who walked into the police station, turned over their drugs or paraphernalia, or didn't, just came in and asked for help, would not be charged. Would be instead fast-tracked into treatment depending on their condition, paired with a volunteer who we are calling an angel, who simply sits with the person as they go through the process of intake, which can be daunting for some people with addiction, and we know that they're more likely to stay and go into treatment if someone is there to either metaphorically or realistically hold their hand through the process. The second part of that initiative was to pay for nasal Narcan for people who couldn't afford it. Nasal Narcan is a opiate blocker that was recently deregulated by the government, and it can be purchased without a prescription. But the disparity between people who have insurance and don't, it was $3 a dose if you had insurance. It was $140 a dose if you didn't have insurance.
Wow.
We didn't feel that was at all in keeping with public safety or service or responsibility in government. So we decided we would use seizure money, which is taken from adjudication of drug investigations, and use that money to pay for nasal Narcan for those who couldn't afford it. The third part was to lobby for legislation regarding the seizure laws and to see if we could get some money earmarked for addiction and recovery as well.
That's so fantastic. So how did you come up with the plan? Was this something that you had thought about? Because it's a change of what the police normally does with addicts. How did you get to that place where you were moving towards that public safety, that help, that outreached hand to say we'll help you, rather than coming at it from the law enforcement side of things?
Yeah, I think that's a really important distinction to make between law enforcement and service to the public. And we came to this conclusion by simply listening to the community. The community doesn't want us to arrest people for addiction and add to their issues surrounding addiction with a criminal charge. We found that if we could be a conduit into treatment or a safe place that people could come 24 hours a day and get treatment, that we were doing a better service for the community. And so the provocative piece of that puzzle is that a conservative entity such as law enforcement doesn't typically get involved in a social aspect of an issue. But it's very much in spirit with community policing. It's very much in spirit with what the community wanted. And we decided to be provocative and put it in policy that we just simply were not going to arrest people that presented in this manner.
It seemed to come at what I would say the perfect moment. And not only to address the needs of opiate addiction here in the state of Massachusetts and in Gloucester, but across the country. This story broke at a time when we really needed some good news about the police and what police were doing for community policing and using that outstretched hand. It's blossomed into this incredible journey, I guess. I don't know, how are you seeing this? What's happening?
Well, we most of us down at the police department have gotten a crash course in addiction recovery and the healthcare systems in 8 weeks. We've had an overwhelming response, as you know. Our Facebook post that initiated the program hit 2.2 million people. It was shared 30,000 times to another 25 million people.
Wow.
It's been shared in 50 states and 39 countries now. And it's brought a lot of support from the public in general. It's brought support from treatment facilities across the country, support from legislature, and we're seeing support at levels of insurance and pharmaceuticals that we are pretty happy about. I think you're right. I think the timing was fantastic, and I think that the realization that this is no longer a problem, where you see, sort of a figure under a bridge with a needle in their arm, that this is affecting your next door neighbor, this is affecting someone you know or someone you know who knows somebody. And I think that raises the awareness of it and reduces the stigma. And law enforcement found the opportunity in this program to lend their voice to the scientific realization that addiction itself is not a crime, it's a disease, and that we could be part of the demand side of the issue and really work with the addicted person.
It's definitely a huge shift that people have been waiting for, it seems, that the police are willing to work with health officials and healthcare entities to make this partnership work. And it's certainly definitely working here in Gloucester. Could you update us on, for instance, the local angle here? So you've helped 35 people since it started, and even even with an opiate related heroin death this week in Gloucester.
Yeah, we have had 6 deaths. And unfortunately, when you're in this type of business in law enforcement, we always like to win. So when a death strikes us very hard when we have a program that is designed to save people from this illness. But we have 35 people who have come into the station and returned the trust that we extended, and all 35 were placed. None were sent home. We don't plan on sending anybody home. They're going to be placed in the treatment that they need without any coercion, without any charges, and fast-tracked into a system that can help them.
So I think it would be helpful for our viewers, for instance, who are in this community, to understand that they can, if a person is an addict, that they can walk into the police department. Could you walk us through some of those steps? I know we covered it earlier, but they come into the police department, they can give over their paraphernalia and drugs?
Well, I really have to hand it to the staff and officers at Gloucester PD who've really embraced this program. And what happens is someone presents at the police station and asks for help, whether or not they have drug paraphernalia or drugs with them. And we've had a good assortment of people who've come in without drugs and with drugs. If they have drugs, they're earmarked for destruction. They're assigned an angel, a volunteer who comes in and sits with them. We call a clinician who comes in and does an intake and decides on the best care for that individual with the individual. And that individual is taken to a partner facility that either the clinician can arrange, or if they can't arrange it, we can arrange it now with the partnerships that we've been able to form with a variety of facilities throughout the United States.
What kind of message do you have for families who might have family members or relatives going through addiction?
Well, I know it's a scary concept to come into the police department, and this is a program designed for people who are ready, to walk into a police department. We feel that people who are willing to take that courageous step to walk into a police station and say, I need help, should be met with no judgment, with the dignity and the respect that we would treat our own family members with, and be given help. So we would encourage families not to force anybody to come in, but to know that we're there for a resource for their loved one, and to know that we are making good on our promise of not charging anybody and not furthering the misery that they're already in.
Mm-hmm. Thank you for that. I'd like to talk about this program that you have called PARI, and it's a nonprofit organization that you started with John Rosenthal, and it's the Police Assisted Addiction Recovery Initiative, also known as PARI, and you can take a look at the website that we're going to be posting through the show. How did this get started? You've just had this big announcement where you've raised $50,000, and explain how this works in conjunction with the Gloucester initiative through the police department.
So, as things went on, and it's been a very fast voyage here. We're talking about 8 weeks from announcement to today, and less than 5 from the start of the initiative to today. We quickly realized that, number one, we didn't want to burden the city of Gloucester with this overwhelming response, and that we wanted to spread the message because so many people were interested. So many people had such a stake in this by the response we were getting. So, John Rosenthal and I got together, and I basically said, look, John, I said, we're going to need some help. We're going to need to be able to spread this message. We're going to need to be able to continue to be a police department while this initiative gets all this attention. And John and I created PARI, which is the nonprofit umbrella that the Gloucester Initiative will operate under. And PARI is designed for a number of reasons. Number one, it supports the Gloucester Initiative. Right now, we sustain almost no costs, no cost to the taxpayer. The costs associated with either transportation for an individual or Narcan for an individual are paid from seized money from drug dealers. But as time goes on and the program grows and we get more, the messaging of it will, may need some funding. The ability for us to support other law enforcement agencies who want to start a similar program will need a certain amount of funding. The ability to distribute nasal Narcan, if it's more widespread, will need funding. We also are changing the conversation at a legislative level,
right? And
that requires some commitment from people. So we and we also want to bridge a gap in the system that we see that in aftercare. So if we do our job well and we provide these services and get an addicted person through treatment and into recovery, there's not a lot of systems in place that you're left out there recovered, but there's no aftercare system. So we want to be able to provide assistance in the form of housing placement, job placement, child care, educational incentives to people who are starting their lives over again. And PARI is our conduit to do all those things.
Well, this is a fantastic program, and I hope that more people will learn about it and take advantage of it. Chief Campanello, thank you so much for joining me on Cape Ann Report. Viewers, please take a look at gloucesterpd.com to find out more information about the Gloucester Initiative and the Angel program. And thank you very much for watching. Until next time, take care.